Hello everyone, welcome back to my channel. Today our topic is Barrett esophagus. Barrett esophagus is a premalignant condition. It refers to replacement of normal squamous epithelium by more resistant columnar epithelium containing areas of intestinal metaplasia. Actually, Barrett esophagus is a histologic change in lower esophagus with columnar metaplasia due to long-standing GERD. Now we will discuss risk factors of the Barrett esophagus. It occurs as a complication of long-standing GERD, men, especially white, and age more than 50 years, and it is weakly associated with smoking. Now type of Barrett esophagus. Short segment Barrett, in which less than 3 cm of columnar epithelium extending cephalad from gastroesophageal junction. Other is long segment Barrett, more than 3 cm of columnar epithelium extending cephalad from gastroesophageal junction. Now diagnosis of Barrett esophagus. Endoscopic biopsy. It is an investigation of choice and definite diagnosis is made when columnar mucosa contain intestinal goblet cells. Columnar metaplasia with intestinal features have greatest risk of transforming in esophageal cancer. Now management of Barrett esophagus. If there is only Barrett metaplasia alone, PPI and endoscopy every 3 to 5 years. Low-grade dysplasia, PPI and endoscopy 6 to 12 months. If there is high-grade dysplasia, esophagectomy surgical removal will perform. Now complication of Barrett esophagus. Most common complication is ulceration with stricture formation and second complication is adenocarcinoma.